To the COVID-19 pandemic now. The New Brunswick doctor linked to a cluster of new cases has now been suspended. He traveled outside the province and failed to self-isolate before returning to work. New Brunswick, until now, appeared to have the virus under control. But as Ross Lord reports, restrictions are now being reimposed as people scramble to get tested.
In New Brunswick, they're learning it only takes one person's poor judgment to stain a spotless record. After announcing this month all 120 people with COVID-19 had recovered, there's a growing outbreak in the small community of Campbellton.
We have 2 new active cases today, bringing the number of active cases to 8. One of the cases is an employee at a long-term special care facility.
There were about 50 residents in that facility, and again, we have a rapid deployment team that was sent there to test them all.
The person blamed for spreading the virus is a doctor who traveled to Quebec and decided not to self-isolate after returning to New Brunswick. In fact, the doctor saw patients at this hospital and possibly other locations for 2 weeks. He's been suspended indefinitely, and the RCMP is investigating possible criminal wrongdoing. The cluster has caused the province to reverse some loosening measures in the Campbellton area, forcing a return to a 2-family bubble. Some Campbellton businesses that were closed then reopened are imposing restrictions again.
We at least lost 30% of our clientele reopening the first time, but now reopening again, I think people might be scared to actually come to public places, so we could lose a lot more clients again also.
The decision of one person, so I'm not blaming all the healthcare, I'm blaming the person that took the decision to do this to the region. We have hundreds of people that came in our restaurants in the past 2 weeks. So we're going to do like everybody else and go get tested, and hopefully we're all good.
For a province that took pride in suppressing the virus, it's a troubling reminder of how easily it can reappear to slow reopening and increase anxiety. Ross Lord, Global News.
Ontario, which is struggling to meet its daily testing goals, is expanding its COVID-19 testing strategy. The targeted campaign will focus on first responders, workers at select hospitals, staff and inmates in some correctional facilities, those who work at liquor stores, and people who live in vulnerable communities like long-term care homes. Pop-up assessment centres and mobile testing units will be used in the province's hardest-hit areas. Ontario's premier says the expanded testing strategy is the best defence against the virus as the province reopens. He's also considering regional reopening. Fentanyl and other opioids can slow a person's breathing, so COVID-19, which attacks the respiratory system, can increase the risk of dying for those who use these drugs. In some parts of the country, harm reduction programs have been helping. Our Heather Yourex-West shows us how one family has benefited from what they call a blessing.
Keegan Tierney has battled drug addiction for close to 10 years.
It's been a struggle, especially the last couple of years. Been homeless, just jail, everything's just, it's been like hell.
But the last few weeks have been different, and Tierney says he has the coronavirus pandemic to thank.
We've seen a glimpse of the sun that we used to know, and it's been a long time since we've seen that.
When Tierney came out of a detox program in April, a local charity offered him a chance to self-isolate in a hotel. And each day, a mobile therapy program comes to him.
So basically, instead of doing fentanyl, they give you a dose of hydromorphine, as well as methadone or Suboxone, and kind of slowly decrease that dose until you're ready to be completely sober.
This is a place where we really could use massive scale up, and that would be very helpful in addressing both the COVID pandemic and the overdose crisis.
Harm reduction advocates believe initiatives that provide a so-called safe supply to those experiencing addiction are vital, both now and after physical distancing measures end. In March, BC became the first province in the country to introduce clinical guidance around the prescription of pharmaceutical-grade controlled substances as a form of harm reduction.
Really, this is our opportunity to see how acceptable, how many people will be willing to prescribe. So it's a guidance document that has been introduced because of COVID, but obviously we would hope that safer supply and pharmaceutical alternatives continue after COVID-19.
Tierney's been told he has a safe place to stay here until at least the end of August. Enough time, he says, to make a plan for what's next. Heather Yourex-West, Global News, Calgary.